Well, it's my great honor to introduce Dr. Stephen Cassivi. He's an honorary member of the European Society of Thoracic Surgeons. Dr. Cassivi is a very highly respected figure in the field of thoracic surgery and well known for his contributions in clinical practice, education and of course research. Dr. Cassivi, thank you very much for being here and welcome.
Thank you very much for having me. This is great.
You are this year the honorary member of the ESTS. How do you feel of being honored?
Well, it's a huge honor, and as I said at the ceremony, it's a special honor because it comes from people that I respect tremendously. The friends and colleagues that I have in the European Society of Thoracic Surgery are amongst my best friends and colleagues, and to receive this honor from them is particularly special. And we've learned together and we've worked together, and I hope to continue to do it. And now as an honorary member, I feel it's going to be even better.
So what are the involvements that you have seen during your career in thoracic surgery?
Well, there's been a tremendous evolution. When I began, I'm very old, so it was in the last millennium. The majority of thoracic surgery was done through large incisions with lengthy hospitalizations and significant morbidity, which limited who we could operate on. So the advent of minimally invasive approaches has been a tremendous change. The operations that I initially learned, I still can do, but we've adapted them through less invasive approaches. Also, the science of what we do has evolved. And we're entering a new age in oncology of immunotherapy that we still have to learn about. There's still answers to be sought in how to best use this new technology and this new form of therapy, which presents tremendous opportunity, but we still have much to learn.
And of course, what are the challenges and opportunities that especially young surgeons face during these years?
Well, going back to the answer that I just gave, in terms of a young surgeon, they have to recognize that what they've learned today may be different tomorrow. And learning the principles is what's really important, because the environment and the playing field will evolve. And so going back to principles and what is good surgery and good patient care will always be helpful, no matter what the new evolution or new changes will be. But being open to adapt, as Joseph gave in his presidential address, it's very important to be able to adapt to the new changes, because change is what is constant.
And of course, all of these are very important that you're saying to us. What are your future goals now?
Well, my first goal, and it's always been, is to provide excellent patient care. At the end of the day, that's what we are as surgeons. So in terms of my number one goal, it's always remained the same: to be the best surgeon I can be for my patient and each and every patient. Beyond that, it's to advance the science. And I think the best way to do that is through collaborations with other surgeons and other institutions and with industry. And that's what the ESTS represents, the opportunity to do that with good people in a good environment, and that's why I'm proud to be a member.
And what would be the message to the young surgeons?
Be adaptable, be positive, be optimistic, but be adaptable. There will always be change, and you have to be open to new things. Remain true to your principles and to the principles of surgery, but keep an open mind to what's new on the horizon, because there will always be something new on the horizon.
Thank you very much. Thank you for being here.
My pleasure. Thank you.